Good afternoon. This is Dr. Christine Sauer, your host of the show Healthy Alternatives, here on 97.5 CIOE FM, with live stream on communityradio.ca every Thursday at 12 noon Atlantic Standard Time. Thanks for tuning in today. In this show, I will talk mostly with guests about all aspects of health, healthcare, and wellness, from conventional to alternative and everything in between. My mission for this radio show is to help change people's lives for the better by informing them about different options to get and stay healthy and well, so they can choose for themselves which option might work in their case. And if you feel you are stuck in a dark place, I want to tell you there is a light at the end of the tunnel. Today, I'm very pleased to be with my friend Ad Rassi, a registered massage therapist for over 13 years, a sports therapist, and he has a few other interesting specialties. Now, Ad, tell us a little bit about yourself. Where do you come from? How did you become a massage therapist? And how did you end up in Canada, in Bedford, Nova Scotia?
Good afternoon. My name is Ad Rassi. I'm a registered massage therapist. My interest in massage therapy came from an accident that happened to my father in 1976. So what happened, he had a car accident, and 9 years later, he had some disc injury due to the car accident. So he had to have surgery. So the surgery required rehabilitation. So I was like 15 years old at that time. And I took him for physio, and he had the 10 session. So I was watching the physiotherapist, how he's helping my dad. So during the treatment, every time I asked the physio question, how can I help him at home? And he said, you can do this technique, you can do this. He said, give me some hands-on. And with that, after his sessions over, every week or every time he have a pain after busy day at work or anything, I feel his pain, he always asks if I can do some hands-on work on his back and his legs. So that helped him a lot. But that put me into interest to continue education in physiotherapy.
Wow, that is wonderful. And I appreciate you sharing that very personal story. That is really amazing.
Yeah.
So that is a long time ago that you started to work in that field, really.
Yeah, hands-on. So for that, I seek to study therapy in Ukraine, because they're very famous in sports. So I have a brother that lived there, so I went to study there. And I did 2 years of sports medicine up there. And then I moved here to Canada. I had a family member here asked me to come. My sister was living here. She said, why don't you move in here and you continue study here? So I came here and went to Dal. And Dal's tuition was a little bit expensive for me. So I kind of put it away until the time and save some money. So I kind of, after 7 years, been working. Then I had a family, and I have a daughter, and I find that there is no time to see my kids growing up. So then after my parents, they keep telling me, why don't you go ahead and finish, your study, what you like and what you love. So actually I went and registered with the massage therapy school in Halifax, and I enrolled, and I graduated 2006. And since then I've been working in that field. And working with some athletes locally and national, and some athletes from outside of Canada that I work with. And that's what have me, be here today and meet you and talk a little bit about what I do.
Wow, that is wonderful. It is very rewarding to be in the helping profession and see people get better.
Yes.
And for you, as a more or less manual therapist, you work with your hands and your brain, of course. It steer those hands to do the right things. You can really help those people. What are the most favorite things that you do? What do you do every day? What really satisfies you?
So I love my job. That's the main things. And that's keep me going. And it's very interesting that I see different variety of injury, general public.
What kind of injuries do you see? What's the most common or?
Most common injury that I see mostly day-to-day living, activity, daily living, which is a patient that they have some problem with back, neck, and shoulders. Some of them, they have the lower back, that they have some sciatica, and some people, they have lower back, and lower back has a lot of factor that's sometimes patient, they tell, oh, my back killing me, which is, they don't know what's coming from. There's a lot of factors that mimic disc problem or sciatica. Sometimes they tell you sciatica. Sciatica could be coming from the disc or coming from the muscle in the buttocks, which we call it piriformis muscle. That's getting trapped as the muscle gets stretched.
Yeah, that's a muscle that's deep inside your bum or buttocks.
The glutes, yeah. We call it the glutes terminology way.
And those who work in sports or fitness, they know what the glutes are.
Absolutely.
But for all the others of us, it's just the bum.
Buttocks or bum, correct. Yes. So that muscle gets trapped right there or get trapped in the lower back and between L1 to L5. And most common come lumbar spine number 4 and 5, the vertebrae between 4 and 5 and S1, most common. So that mimic as well. Some people, they could have a kidney problem. So I have an athlete, he was competing in Hong Kong. He contacted me 2015 in December, and he asked me that he have some pain here and there. So I was educate him over the phone, actually. And I told him, just take a picture, tell me where's your pain. He sent me a picture. I told him, okay, how's your urine color? And he said, well, I peed some blood yesterday. I told him, okay, so that's not musculature. He said, what do you mean? I told him, it's your kidney. Mimic pain right there. So refer pain in that area that you have in your groin and in your lower back. So
that's not very rare, actually.
Yes.
Yeah, many people have kidney stone pain in their back.
So that's a lot of stuff, mimic stuff like this. Even some patients that I see that they have some headaches, they tell you, I have migraine or I have a tension headaches. And I do my assessment, and I notice sometime that people, most common, their pain coming from musculature, trigger point, we call it knots usually. So the trigger point that's in the muscle and the shoulder, they call them upper trapezius, or the suboccipital or semispinalis, that run between the shoulder blade all the way up to the back of your head. And there's another muscles that's in the front of your neck that's very important to get treated, because that's mimic some tension headache.
Oh, that's interesting. So really everybody that has tension headaches, and I mean tension that refers to muscle tension anyway, but there can be really trigger points. Is it the same that we feel as knots, and when you massage them, they hurt like hell?
Yes. So those one, what we do when we work on them, I always check with the patient and ask them, is the pain refer? So if the pain referring to the area that they have pain.
So referring, you mean it radiates to other areas?
Radiate, yeah. So referring, radiating to the temporal or the forehead. And sometimes they tell me, right, coming into my eye. That's the same pain that I'm experiencing.
Yeah.
So that's me in trigger point issue. It's not something to do with their tension headaches or the brain compression or tension on the brain.
So that's really interesting to know. So everybody really that has headache should go to a experienced massage therapist to get an assessment to see if it's a trigger point, because you can feel it, right?
Absolutely.
And it's different from what your doctor does. And I mean, if I always recommend go to your family doctor too, and check out that it's maybe something more serious or more sinister, like a tumor in your brain. Make sure that it's not that. You don't want that. And if the doctor tells you, oh, well, it's just tension, nothing you can do, take aspirin, no, see Ad.
Well, other things we can do as well, vertebral artery test to check other things. So where we do vertebral artery test, that we check that to check that vertebral artery that go into your brain. We put the neck into a certain position in order to check that if any minimal quantity of blood going up to your brain through that artery, that will create a little bit less oxygen going to your brain. You might feel more lightheaded, or you may feel a little bit dizziness or anything. That test will mimic. That way, when we have that test positive, I automatically refer them to a physician to go for further testing.
To a vascular surgeon and see if the arteries are narrowed and you need to do something to avoid a stroke, maybe.
Absolutely.
Yeah, that's a very valuable test. I've never seen that done, that a massage therapist does it. So that's amazing. So you do those?
Absolutely.
Wow.
We do a lot of neurological testing for the nerve that exit in your brain. We call them brachial plexus, the one coming from your neck, or lumbar plexus, plexus that go from your lumbar spine, your lower back.
Lower back, yeah.
So any entrapment happening in the neck, where's the nerve exit, and where's the nerve exit, the lower back as well. So those one will test the extremity to see where's entrapment we have, either in the disc, either in the muscle, or in any joint that's happening.
That is really interesting. So you probably would be able, if somebody has probably thinks they have carpal tunnel, you would be able to say, is it just your carpal, is it your ulnar, is it your brachial plexus on the shoulder?
So if anyone coming to you with pain that's shooting down, we'll check the dermatome, we call them. So where's the pain going? If past the elbow, then this will be coming from the level of your vertebrae number 6, for example, it's past the elbow. If just to the elbow, will be like C3, C4, which is meaning disc number 3 and 4.
And
if you have it in the finger, will be the 8.
It comes from the spine and not from an entrapment at the ulnar nerve here or at the carpal tunnel.
With the carpal tunnel syndrome, could be just entrapment happening during into the elbow, or into the tunnel, which we call a tunnel because the median nerve, go through a tunnel in the wrist, and that get entrapped right there by the tendon that's coming from the arm, the forearm.
And they all go in one tunnel.
They go they go next to each other. When they rub against each other, create scar tissue, and the scar tissue will happen. No more space for the nerve to pass through that tunnel. That's why we call it carpal tunnel syndrome. So there's compression from the scar tissue that develop from the tendon friction happening because we move our finger all the time when we type in on a computer or we're playing any sport or anything. That happen. Repetitive movement and repetitive motion create a lot of the body will lay down collagen fiber, and collagen fiber turn into adhesion, and adhesion turn into scar tissue, and that's what gets entrapment happen.
So can you, with a massage, loosen that entrapment sometimes? So
what we do with massage therapy to help people with carpal tunnel syndrome, we treat the muscle where it originate and where it insert the muscle belly, and then we go to the tendon to friction those adhesion and scar tissue. When we break them down, the body is going to notice the pain for a day or two. So that's normal when you have that, where we give the patient some remedial exercise to do at home, to do stretch. We tell them to do heat and ice, stretch, heat and ice, and that will help realign those muscle fiber or macrofiber that we break down to have more space to the nerve to passage. But that's close to 4 to 6 weeks treatment of 2 visits per week.
So that would be an option to try before you have surgery. Try if it works, and if not, you can still have surgery.
Absolutely.
And that brings us to the end of the first half of today's broadcast here on 97.5 CIOE FM. Please tune in after the commercial break for more about massage and related issues with Ad Rassi. Thank you. and welcome back to Healthy Alternatives here on 97.5 CIOE-FM or on the web at communityradio.ca. I'm your host, Dr. Christine Sauer, and today I'm happy to talk with Ad Rassi, massage therapist, sport therapist, and so much more, really, and an interesting human being too.
Thank you.
And in the break, we talked a little bit about TMJ problems. Now, TMJ stands for temporomandibular joint, which most people just know as their jaw joint.
Correct.
Tell us a little bit about it, because I know that's one of your specialties, and you're the only one so far that I know that really specializes in that besides dentists.
Mm-hmm. Well, TMJ is a joint that's located in the jaw, which most of us know. This joint has a disc, and the disc contains synovial fluid. And sometimes people, due to a lot of factors caused by bruxism, which is mean you clenching your teeth while you're sleeping, and sometimes the development of your jaw, the lower jaw, that's what happened, sometimes can be protruded, which is mean going forward or sit backward. And by opening and closing, sometimes a lot of people over the years, they have a little bit noise happening right there with some clicking. Mm-hmm. The clicking noise, a lot of people, they say, oh, my jaw click. So what's that mean? The joint right there, the disc will go either forward or backward. So the disc is situated in that joint, which is coming like it's like a socket and a head. And as time we open the jaw, what happens? Either the disc will go forward or go backward. That's what creates a little bit the clicking noise.
So that's a little bit like the meniscus in the knee.
Just like we can say it like the hip joint.
Oh, okay.
Yeah, the hip joint is like a ball and socket. Okay. But this one are on a small scale, yeah. Different than a hip. So that clicking happened right there because we have the disc right there.
Okay.
That disc, same thing as the disc we have in our vertebral column.
Yeah.
So factors that cause that sometimes happen a lot with guest speakers, because they speak a lot, or with broadcasters, or with priests, or with singers, due to repetitive motion that happen in the jaw. Or with children as well these days, because that's why most orthodontists recommend braces, or dentists recommend braces for children to prevent those injuries.
Okay, so misalignment of the teeth can cause problems with your jaw joints.
Absolutely. So, yeah. When you're born with the jaw gut, you see some kids, sometimes their jaw is sitting backward.
Yes.
Right? So they can alignment, or some people, they have jaw forward, depend. So that's what caused that. So it's very important that the dentists, what they're doing right now, they send them to orthodontists, which is a great way to prevent those from happening. And sometimes when we age, we have some loss of teeth in the back of our mouth, or the molar teeth. That will create a little bit of space and a little bit changing in the joint itself, and that will create a little bit of pain right there.
That is interesting. And I know I've been told myself that the teeth were misaligned actually after orthodontic treatment as a child, later on when I was in my 20s, and they grounded the teeth, and it solved the problem somehow. And sometimes it does it, and sometimes you do need a biplate, and sometimes it's more muscular. Can that be true?
The bite plate, let's talk a little bit about the bite plate. So if kids have misalignment of teeth, so they have the wisdom teeth. The wisdom teeth get removed at a time if it was required, because after you have your braces done, your teeth will be coming out. So those, if they get removed, it's required to have your bite plate on, the wisdom teeth. Yeah. So when the wisdom teeth are removed, you're required to wear those bite plate in order to prevent damage or changes to the structure of your joint. So the second thing that we have, misalignment of teeth or anything, bite plate will play right there. And musculature-wise, we have a lot of factors with our human body that create that. So some tension sometimes coming from your shoulder, the chest muscle. It's called a platysma. It's a big muscle that's sitting right from the lower jaw, go all the way down to your front of your chest and go over your shoulder, left and right. And then your shoulder muscle, trapezius, then other factors, they call them sternocleidomastoid, and the deep neck flexors, right?
There's
if I name them all for you,
different muscles in your neck that have to work together properly to not give you problems.
So we treat those muscles, and then we start working on the pterygoid muscles. After we work the neck muscles, we prepare all that, and then we can work on the jaw muscles. So the jaw muscles that we can work them externally on the face. It's the one that's called chewing muscle. We call it masseter. And then we have the pterygoid muscles, which is we do intraoral work. We wear gloves, and we do intraoral work and with watching the patient for facial expression, if any pain or any gagging or anything they might cause during the treatment.
Yeah, some people gag easy.
Yes.
Yeah. And it's interesting to know that your jaw joint is located right in front of your outer ear.
Exactly. So if you put your finger right in the front of your ear, you notice it right there as you open and close. So there's these factor, paroxysm or muscle atrophy in the jaw muscles. And we have also another muscle that's called temporalis, which is coming right in the temporal bone. And it's a fan-shaped muscle that's originates right on top the parietal bone of your head, and then go all the way to the joint, cross the joint.
On the sides,
and
on your temples.
Above, on the temples.
The temporal muscle.
Right, yeah, right above your ears. And so you put your finger all the way. If you cap your ear and you put your finger, will be exactly right there, and you feel them as you clench your teeth. So those one, the symptoms that we have sometimes from the jaw pain, we can refer to your temporal bone, to that muscle, right?
Yeah.
And can refer also into the joint or into the jaw muscle, right on your cheek on each side, and sometimes refer into your eyes, your frontal head,
your ears,
and your ears, and the ears as well. The ears, a lot of patients come to me, they tell me, I have a ringing ear. Or I have a whizzing noise in my ear. That could be another factor. That could be the joint, the TMJ. That's causing those
problems.
Those problems. Yeah.
That's really interesting.
Yeah.
And I know some people, they crack nuts or candy with their teeth, and they chew always on one side. Like we are right-handed, we chew on the right side more. I think. Can that cause problems also? It's,
as we know, our body, it's asymmetrical. So if you want to just focus only on the jaw, the whole body, it's asymmetrical. So as right dominant or left dominant, that's factors that what we should be aware of our activity, daily living. Whatever we do with the right, we should do with the left.
Yeah.
But we cannot do that. But as much we can incorporate the left side, for example, just to take over the pressure on the right side, because our right side you're working too much with it, or the left side if you're dominant. So the same things for the jaw. We have to work a little bit symmetrical, but our body always asymmetrical. So it's great to chew on both sides. As we're aware if we're trying to develop any pain or anything, we should, alternate.
And I think that's a very important point, that you should be aware of your body. People should eat mindfully and be aware what they do. And that's not just by eating, but aware of the pain, aware of asymmetric things, of other things in your muscles too. And you probably see a lot of asymmetry.
A lot of asymmetry in our human body. Even in your eyes, you see one more opening, your head, your shoulder, you see even our cranium, which is the skull, our head, you see one side to another side. That's due to muscle imbalance that's pulling one side to the other and create a little bit asymmetry in the cranium as well, in the head.
Yeah, it's very interesting. And there was a whole science phrenology years ago about the shapes of the head on the right and the left, and
Absolutely.
they tried to tell people with certain heads they are criminals and whatever. It doesn't work. It was for a while. It was quite popular. So it's really, really important to watch for your body, and if you don't get the results with one professional, maybe try another one.
Absolutely.
Because as you see, Ad does so much more than most massage therapists. Most massage therapists say, where does it hurt? And then they massage on there and massage the knots out of the body, which is nice.
Yeah. A lot of us in the industry that each one of them has different technique,
Yes.
and we all here to help our patients.
Yes.
And every therapist with their expertise and different technique, and that will put you at a different level. So there's a lot of therapists that they have a lot of experience in the background in their toolbox.
Yes.
And they had worked with other healthcare practitioners, and they develop a different technique. For me, I can say that I've been working with different other health practitioner, and continue education that I was do my courses every year. I do 1, 2, or 3 courses, continuing education, and sometimes I take courses locally and nationally.
And I think we should mention that if you want to contact Ad, his website and email is info@allsportsandwellness.ca.
Right.
And thank you very much, Ad, for
You're
being
welcome.
on the show. This brings me to the end of today's show. Please don't hesitate to contact me with any questions, thoughts, comments, or suggestions. Or if you'd like to contact Ad and forgot the website, my email here is Christine, CHRISTINE, @communityradio.ca, and I'm always grateful for any feedback. I also want to extend a special thank you to today's producer, Jim Francis. Jim, you're the best. Thank you all for listening to Healthy Alternatives. I'm your host, Dr. Christine Sauer. Tune in next Thursday at noon on 97.5 CIOE-FM Community Radio with live stream on communityradio.ca for the next episode. Goodbye and have a great day.